Please welcome President and CEO, Change Healthcare, Neil Crescenzo.
Changes. Turn and face the strain. Changes. It's gonna have to be a different man. Down, made change.
Welcome, everyone, to the afternoon session, and hopefully, as you've probably already experienced at this conference, there's going to be a lot more inspiration and excitement on how we can change healthcare that you're going to hear from this afternoon. I'm very excited to be here. The title of this session is around the patient experience and how we can make it easier for the healthcare system to make it easier for patients. This is something that we've been committed to for a long time at Change Healthcare, and it's something that I'm excited to share with you some exciting news today. Let me start, since all of us are patients, or if we haven't been yet in our lives, know people who've been patients. And you've heard a lot about the patient experience already at this conference. How many of you would describe any patient experience you've had as frictionless? Probably not too many. And this is something that we've heard a lot of ambition around having a frictionless patient experience this conference. And what I want to talk to you about is how we can actually do that. And a lot of the lessons learned around consumer experience need to come, frankly, from the experiences that we've had as consumers in other industries that now we can bring to the ambitions we have in the healthcare industry. Probably many of you, I don't know about I did, stood in line at Starbucks maybe to get a coffee over the past couple days. And yet there was a place to get coffee just literally 20 feet away. Starbucks made it easier on everybody by being able to order the coffee from your room. These things are the way consumer-oriented companies orient themselves to provide a better experience for their customers. And this is a goal, again, we've heard from a lot of organizations at this conference. And what I'm going to talk to you about is how Change Healthcare is partnering with two of the leading companies in the world that focus on the consumer and how they integrate into the business of healthcare, and how we can orchestrate and improve these patient interactions with the healthcare system, deliver a seamless experience, and for providers, have increased patient loyalty and the ability to attract new patients. Change Healthcare, for those of you who don't know the company, we're about 15,000 team members strong. We try to inspire a better healthcare system through the work we do every day around collaboration, helping our customers achieve better outcomes, and reducing costs. We do that with payers and providers and consumers through our customers, through a wide range of solutions around data, analytics, our network, and our technology-enabled services. Our intelligent healthcare network processes clinical, administrative, and financial transactions for hundreds of thousands of caregivers, including physicians, hospitals, integrated delivery networks, and other providers, as well as commercial and government payers, through a variety of transactions that really help healthcare operate in this country. And you can see some of the stats behind that on the slide in back of you. What I might mention is that we process about $2 trillion of the $3 trillion in claims processed in healthcare every year in the United States. So given this focus on collaboration and really trying to help healthcare operate as a system and understanding how we need to put the patient at the center of everything we do, we were very excited about participating in this inaugural health conference here this week. When I think about what we're doing in the industry, it really comes down marrying what happens with providers, payers, and the people who have been doing such a fantastic job trying to improve healthcare for years, relative to these new trends that we've all been talking about this week, and kind of the inspirational both explorations and achievements that we're hearing about at this conference. Some of the facts behind why this change is happening now, I wanted to share with you. There's been a great deal of consolidation in the healthcare industry, and of course it's continuing when you look at transactions like the CVS-Aetna merger or the Cigna Express Scripts merger. But on the provider side, we've actually seen a slowing of the consolidation which has really been progressing at a rapid pace for the last 5 to 7 years, a 14% annual increase in deals around provider consolidation. However, and this is a somewhat controversial figure that came out from the FTC, but the FTC has said in most of the metropolitan districts now, 90% of them are highly concentrated, meaning that the provider consolidation, the ability to grow your impact as a provider on your community through more consolidation is really starting to plateau. What that means is that these organizations are now thinking about how do we attract and retain patients, because frankly they're not going to come to our doors as much as they've had historically through acquisition. At the same time, this growing orientation of the consumer that you've heard about at this conference is backed up by the facts. There's been on average about 3% per year of volume shifting from the inpatient environment to the outpatient environment, leading to people really thinking about where they're investing their capital dollars, their infrastructure, and their focus. And you've certainly heard a lot at this conference about retail-oriented care and things like the CVS-Aetna merger and what they're trying to accomplish, urgent care growth, telemedicine, new ways of trying to provide care, including in disadvantaged communities like City Block. And there's about $200 billion of healthcare interactions that are now coming through what we would call the new front door of healthcare. In addition, the way that institutions have competed and tried to grow over the years in healthcare is changing. Over 75% of healthcare institutions have said historically, we've really competed by trying to be more and more cost effective. And of course, that's not going to change. But if you think about many industries, they compete on many other fronts. And that's increasingly what our healthcare customers, what I like to think about as these practical visionaries, are trying to do. When you think about things like patient experience and why attracting and retaining patients is even more important than ever was before, it's telling to remember that almost half of consumers every year visit a new physician. And this is not only because people tend to have different reasons for going to different doctors during the course of a year, but if you think about your own life and as you progress through various parts of your life, you're going to not see a gerontologist when you're 20, and you're probably more likely to see a sports medicine physician before you're 60. So as you go through life, this is naturally going to be something where patient attraction and then, of course, retention is going to be important for the healthcare system for many years into the future. In addition, when we think about what this orientation to the consumer has meant, you've heard a lot of people talking here about how they're oriented in this fashion, but I thought it was very important that a lot of the sessions focused on how is this going to actually impact the provider from a financial perspective. You know, we talk a lot about value-based healthcare, and the reason why is that we're just now starting to see a trend whereby providers really can do well by doing good, even if they were formerly primarily an inpatient-oriented provider, and now can see how they can do well if they keep people healthy, even if that keeps them out of the hospital. As been mentioned through many of the presentations here, I heard somebody say, it was Ben Wanamaker from Aetna, that less than 1% of the time in your average existence and during the year do you actually see a healthcare professional. And even if he's off by a couple of percentage points, it's still a fairly modest part of the year. So as people think about how do we actually keep people healthy, the patient experience, or really the consumer experience, is coming to the forefront. The other part that's important to recognize is that this is actually the way people are changing their decisions to reflect this new reality. We saw just a minute ago a video from UPMC and all the great work that they're doing in the greater Pittsburgh area and other geographies that they've expanded to, including around the world. One of the UPMC executives said here yesterday that when they look at investing and applying capital, making decisions, and it's between something that will help keep the people healthy in their area versus something that might, in fact, help fill the hospital bed, despite the fact that a large percentage of their revenue still comes from their inpatient admissions, they now are going with the former, not the latter. That is really an important sea change in U.S. healthcare. So we believe that what's going to be increasingly important is to have these interdependent, non-disruptive workflows and seamless execution well beyond the environment that we've historically called healthcare. And to do this, we believed we needed to reach out. So what we're announcing today is a partnership between Change Healthcare, Adobe, and Microsoft to bring healthcare-specific solutions that we believe will revolutionize the patient experience well beyond the boundaries of what we typically call the U.S. healthcare system. The reason why we believed we wanted to reach out with partners like this is because while at Change Healthcare, we have a great deal of healthcare data and expertise around our domain knowledge, our customer relationships that have been built up for more than 3 decades, and the ability to understand how to help our customers navigate, especially these new areas. Adobe has a rich, also more than 3-decade experience around how to help customers understand consumers and the customer-consumer experience. Microsoft, as you'll hear in a minute, has a great deal of expertise, of course, in how to partner with companies trying to do these things in the business environment, as well as enormous investments in their cloud, AI, and other infrastructures. Together, we believe our capabilities are complementary and will allow us to create solutions that will revolutionize patient experience across the continuum of both care and outside the healthcare system. So with that, I'd like to call to the stage Matt Thompson from Adobe and Dr. Simon Koss from Microsoft. Please welcome them to the stage. So first, let's start with Matt and Adobe. Matt, I'd like you to come up and talk a little bit about Adobe's vision of this market challenge and the capabilities you bring to this partnership.
Thank you, Neil, and good afternoon, everybody. I'm very excited to be here. You're probably wondering, what is the Photoshop and PDF and maybe Acrobat company doing on stage today? Well, I want to talk to you about our own transformation that we've gone through over the last few years and how exciting that is and relevant to the conversation today. Our mission is to change the world through digital experiences, and digital transformation is front and center for all industries, including healthcare. Searching for healthcare information is the 3rd most common search online on the internet. And we look at this, the statistics here on stage, that translates to something like almost 120 million Americans self-diagnosing online. Data is beginning to empower patients. They have very, very high expectations across industries outside of healthcare, and we're very excited to bring this expertise to healthcare. Adobe manages more than 230 trillion transactions. 230 trillion transactions on behalf of our customers each year. We're privileged to work with top brands like Marriott, Nike, T-Mobile, Delta Airlines, and in healthcare, brands like Kaiser, Aetna, Mayo Clinic, St. Jude's, and of course, Change. We go to market and serve our customers across 3 different clouds, and I'll make this relevant very quickly. Think Creative Cloud is around those content creating and authoring tools, Photoshop, InDesign, Illustrator, et cetera. Document Cloud, PDF, Adobe Sign, Scan, et cetera. And then the Experience Cloud, which I'm here to talk to you today and is most relevant to the topic and the conversation at hand. Analytics, advertising, and marketing clouds leverage data to deliver those personalized experiences that Neil was talking about that are so important in healthcare today. That means providing patients what they want to see, when they want to see it, and how they want to see it. Adobe is committed to helping healthcare organizations make experience core to their business because patients have never had a higher expectation around experiences across the multiple devices that are in their lives today. I mentioned a mission earlier, changing the world through digital experiences, but it bears repeating. We share a focus on digital experience with both Change Healthcare and Microsoft. We have a very deep partnership with Microsoft and have been working on solutions with them across industries around the world for the last 2 years, and it's a natural extension, and we're very, very excited to be partnering with Microsoft and Change around healthcare. We share a common passion together, our three companies, which is to transform the patient experience. You heard Neil talk about that earlier. This partnership is much more than co-selling or a marketing partnership. We're connecting back-end systems, administrative systems, and a connected platform that is going to link the delivery chain and provide that ultimate consumer, the patient, the kind of experience that they want, need, and deserve as they're going through maybe some times that are a little bit difficult. Our goal, the three companies, Change, Microsoft, and Adobe, is to really bring first-class solutions to your industry, and we're very excited to do that, and we think that we're uniquely capable of doing that. Thank you very much for the time to address you. With that, I'd like to introduce Simon.
Good. Thank you. So, I'm Dr. Simon Koss, I'm Microsoft's Chief Medical Officer, and we are absolutely delighted to be a part of this partnership, these three organisations coming together. What does Microsoft bring to the partnership? Well, I'd call out three things. I'd call out engineering, I'd call out partnering, and I'd call out research. From an engineering perspective, we create software platforms and productivity tools, and those technologies have a focus today on the cloud. We believe that the cloud is the way to overcome some of the traditional constraints that we've got in healthcare, around security, around compliance, around interoperability, computational power, and keeping our systems up to date. But it's more than just doing the same. We believe that the cloud allows new capabilities that have never been there before, and it's things like artificial intelligence that will allow us to deliver on the promise of a better patient experience. From a partnering perspective, we're not an organisation that makes first-party health products. Our partners do that, and supporting our partners is in Microsoft's DNA. We have between 12 and 14,000 partners in healthcare around the world, and it's by pooling our resources that we're able to bring these solutions together to market faster through combining our unique workforces together. And then finally, on the research side of it, Microsoft operates a pretty significant R&D function. It's funded to the tune of about $10 billion that we spend on that annually. And many of the technologies within that stable have a focus on artificial intelligence and bringing the next generation of health technologies forward into the market. So within our Healthcare Next group, we focus on things like natural language processing and voice. We focus on machine vision. We focus on biosurveillance. All of these things make sure that as we progress in this partnership, we've got access to the very latest technology and the best thinking in the industry. So we could not be more delighted to be a part of this exciting announcement today.
Well, thank you, Simon, and thank you, Matt. There's been a lot of discussion at this conference about how we need to think about healthcare differently, how innovation is going to happen outside the traditional healthcare delivery system as typically referred to. And we've heard a lot of leaders in the, let's call it the traditional healthcare delivery system, whether it's Stanford Medical Center or whether it's UPMC or many other organizations here, describe how they're going on that journey. We believe providing the kind of insights from the consumerist experience of literally hundreds of millions of people that Adobe represents, the infrastructure and advanced research that Microsoft represents, and the domain knowledge and insights into our customers and our own intelligent healthcare network that Change Healthcare brings to this partnership will allow us to help those organizations that you've heard from this week realize their dreams. We're open to working with many people throughout the industry. If you want more information, please go to our website, changehealthcare.com, because as Simon mentioned, we view this as just the beginning and a way to activate the kind of partnerships across the industry that will really help us take the patient experience forward for all of us our children, our families, and friends in the years ahead. Thank you very much.
Thank you, Neil, Matt, and Simon.